So we have got this patient who is having a large cellulitis and abscess in the left facial region, and he is diabetic and also has got few decayed root stump, which is the source of infection. And
we have a patient here of multiple space infections. As you can see, this is post-op 7 days. The patient had reported to us with a lot of swelling obliterating the infraorbital region. She was not able to open the eye. There was almost, as you can see, this much of swelling was there. She had very restricted mouth opening. So, and there was a lot of pus which was coming out from intraorally as well. So just take it back slightly. So this is post-op 7. As you can see, she is having nice eye opening. We have just removed the sutures from this anterior area. There is if you can turn this side and come this side please. This was the area which we had accessed the submasseteric space from. As you can see, it has closed up itself very nicely. If I press this, there is no more discharge or anything coming from here. There was a drain which was removed post-operative day 3 post-operatively. She still has a little bit of, which because she has sugar, because she has uncontrolled diabetes, this wounds will take some time to heal. She still has a little bit of inflammatory fluid coming out from this area, which we are going to handle with antibiotics and obviously good diabetic control. We are also planning a scaling. As you can see, her oral hygiene is not that good because of the uncontrolled diabetes as well. This is gross periodontitis. So we have to do a scaling. There's a mobile tooth there. We'll think about maybe removing it as well. But if you see in the anterior region, in the posterior region, there's nice healing which has occurred there. Ma ekটু জিভটা বার করুন please. She is able to move her tongue nicely. No more respiratory issues. She was having some respiratory issues as well. And one more thing which I would like to say is চোখটা খুলুন ভালোভাবে. I can palpate both her zygomas here, okay, which was absolutely not palpable the first day she had reported to us, right? So she's still in the healing period. We are having to give her a little more, at least 10 to 15 days more for her to for the face to come into full normal shape. And one more thing which I would like to say, since we drained a lot of pus from this area and obviously the facial nerve is just there would be obviously some traction injury which has happened there. So this is also going to come back. If ma ekটু মুখটা ফোলান, জোরে মুখ ফোলান এবার এরকম করুন, আমার দিকে এরকম করুন, চোখটা জোরে বন্ধ করুন. So the nerve functions are relatively fine. That is what we were a little worried about after the surgery. But now things are fine with a lot of physiotherapy and obviously a combination of good oral hygiene and sugar control. We hope to get her back to period. Okay, thank you.